Today we will talk about an interesting topic called retinal migraines. Retinal migraines are not very common conditions we come across, but it's a unique disease which presents in a different symptoms. Like a patient can present with loss of vision which could be complete or partial and in one eye, which is sometimes very frustrating for the patient. Sometimes they can present with a complete or partial loss of vision along with zigzag lines, sometimes kaleidoscopes, different colors in one eye. And usually these symptoms last less than 60 minutes. And after that, patient can present with headache, throbbing headache. Sometimes the other presentation is you can present with these symptoms of complete or partial loss of vision, zigzag lines, without any headache. I always recommend to my patient that always rule out certain serious conditions before coming and making the diagnosis of retinal migraines. Like this could be the presentation of a stroke, this could be presentation of the swelling of the nerve of the eye or the detachment of the retinal nerves, of the retina. So I always tell to the patients, if you come across these symptoms, always get immediate attention, always go to the nearest ER and get it checked and make sure everything else is okay before. But this is something always keep in mind. So whenever you present this and they ruled out the stroke, optic neuritis, retinal detachment, so always talk to your neurologist or ophthalmologist about retinal migraines, because there is an appropriate management of retinal migraines and it affects the quality of life of the quality of life of the patient. So what I will say is, if you present with these symptoms, always get the treatment so you feel better. And after getting the treatment, your symptom will improve and the quality of life will get better. That's all I would say about retinal migraines.